Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by the members of the media after he makes some brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information Contact, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn this over to Dr. Alex Garza.
Okay, thank you, and good afternoon, everybody. Thanks for joining us this afternoon. I hope everyone had a good holiday weekend and that we were all able to pay our respects to those who gave the ultimate sacrifice to our country. Their unselfish devotion to our country should never be forgotten. It's been about a week since we began our gradual reopening in the city of St. Louis in St. Louis County, and so far, as you've seen, our numbers continue to have that slow but steady decline. And that's not unexpected and should not be correlated with an all-clear signal, however. We know this because there's a lag time between incubation periods, and it will take weeks to see if there's any changes in our admission or our hospitalization data if there's going to be an increase in cases because of the relaxation of shelter in place and the reopening of the economy. So before we get to today's data, I'd like to talk a little bit about those viral photographs taken at the Lake of the Ozarks this weekend. So I'm sure you've seen all the photos that have circulated throughout the media, both here locally and nationally, of significant gatherings of people without social distancing or protective measures to decrease that risk of transmission of the virus. Now, without a doubt, actions like these increase the probability of cases continuing to spread in the population and further risk needless suffering and potential strain to our healthcare systems. However, I don't want to dwell on the actions or overshadow the vast majority of people who did the right thing. They practiced social distancing, they wore masks, they didn't gather in large groups, and by doing so, they did their part to protect the vulnerable. We want to recognize and thank everybody for doing their part to help stop the spread of the virus. And we must all continue to remember that the virus hasn't left us, it hasn't changed, it's still here, it's still very contagious and dangerous. If we let our guard down or act like the virus is gone, it will continue to improve the odds of hitting our region again with a second wave. And those really hard-fought investments that we've made to suppress the curve will be wasted. I want to again remind everyone how important it is to continue to keep social distancing. Isolate if you think you've been exposed, wash your hands, avoid touching your face, and all of those other things that we talk about frequently. We really do have an obligation to keep each other safe. Now with that, let me go ahead and jump to our data. So again, here's the chart showing our hospital admissions, and it continues to show progress. Again, it shows the trend in daily new hospital admissions since early April. The rolling average continues to show that steady decline since early April. Now remember that this data reported on this chart are lagged about 2 days, and so what you see now is our latest reporting date is on Sunday, where we admitted 12 new patients and the 7-day moving average decreased to 22. And I believe 12 is the lowest day of admissions that we've had since really the first day that we began tracking this data, and so that's very exciting. So this continues to be an important trend and an indicator at the level of suppression of the virus in the community, and we want to continue to see it come down and stay as low as possible as we begin to reopen the economy. This next slide again shows our hospitalization data, and so these numbers continue to show progress as well. So this is our daily hospital census of COVID positive and suspected COVID patients, as well as the rolling average, which is the blue line that you see there. Today's rolling average is 421 and continues to level off and be as low as it's been since we began tracking the data, so that's a good thing. Today's overall hospital census decreased from last week. Today it's at 415, down from 487 last week at this time. We want to see these numbers continue to trend downward, and we want them to stay low. This is the slide that we traditionally show, and it's made up of our daily hospitalization numbers. So as I mentioned, we had 415 hospitalizations today of confirmed COVID and suspected COVID patients, up from 395 yesterday. But again, it's important to look at the trend and not fixate on those day-to-day fluctuations in the numbers. We have 86 confirmed COVID or suspected COVID patients in our intensive care units, which is down from 97 yesterday, so that's good news. And we have 62 confirmed COVID or suspected COVID patients on ventilators, which is down from 71 yesterday. So again, down below 70. It's always a good number. And then our good news slide, our discharges. Yesterday, we discharged about 18 COVID patients, bringing our cumulative total to 2,123 since our first confirmed COVID patient in the region. So exciting news there. And thanks to all those healthcare workers who help get these patients better, who work on weekends and holidays so that these patients can go home. Thank you for that. So the progress we've made in this region has been really incredible. And keeping the right measures in place will keep us from preventing spread so that we can gradually and thoughtfully reopen our economy. And we'll keep a very close eye on this data as well as other data as we continue to make decisions during the next phase. And with that, I'm going to stop my briefing and move to questions. So thank you.
Our first question, the state has acknowledged inflating its testing numbers by including tests for antibodies. Has St. Louis public health officials been doing the same? And do testing numbers being released today reflect purely tests for COVID-19, or do they include antibody tests as well?
So a good question. The honest answer is I don't know if they included that at the county and the city level. I am assuming, because I believe the data comes from the state, that those would be included, but I don't know that for sure. I'll have to check with the county and the city to see if those numbers have been adjusted for antibody numbers. Just so everybody remembers, antibody testing is good for epidemiological surveillance, so we know how many people have been exposed. The PCR data, which is the important data for looking at infections, that's if you have an active infection. And so those are the ones that we do tests on people that are symptomatic or think they've been exposed to COVID.
Do we expect to see a spike in cases as a result of the packed lake parties this weekend?
Good question. I've been getting that quite a bit lately. So the answer is maybe. It depends on a number of things. Obviously, people coming together without practicing social distancing, without wearing masks, all of those things increase the probability of transmission. And it would be difficult to say that there wasn't somebody there that could have been an asymptomatic spreader, exposed a lot of people. Is challenging. And then the people will go to different parts of not just St. Louis, but all over the Midwest. And then it's how they interact with other people, the length of time that they spend around with other people, if they were exposed, when they become symptomatic. There's a lot of things that play into this. Of course, if you're around people that are highly susceptible to the virus, that increases the chance that we'll see in cases. So the bottom line is, though, that any time that you're ignoring all of these practices, whether it's social distancing or wearing masks or not washing your hands, you're always increasing the risk of transmission. And so without a doubt, this type of activity and this type of behavior increase the risk of transmission, which means it can only go in one direction or stay flat. But it definitely is not contributing to bringing rate of transmission down. And so if we do, it wouldn't be surprising, but it remains to be seen if and when.
There are questions being raised about the criteria for counting a death as due to COVID-19. Some are alleging the numbers are being inflated, with many of those listed as COVID-19 deaths being the very elderly with terminal illnesses or others with serious chronic conditions. Can you talk about what criteria are used to designate a death as the result of COVID-19?
Yeah, so a good question, and you're correct that a substantial number of COVID deaths, the majority have been in the elderly population, many of them with chronic conditions or even other terminal diseases. And so the way that the death is classified is if it was the primary reason for the death, and then other things are listed as contributing to the death, such as diabetes or high blood pressure or other sorts of things. And so in some aspects, I guess you could say that it is a death contributed by COVID, but they would have died otherwise. And that's true, but that's probably actually a smaller amount of numbers than you would think. Now, I think certainly everybody understands that people with other conditions, COVID hits them hardest. And so this is really what's called excess mortality. And so would this patient have died at that time were it not for the COVID illness? And if the answer is no, then that's not excess mortality. But this is a pretty common statistic that we use in epidemiology to look at the total impact of the virus. There's been reports coming out of New York City showing the excess mortality that's occurred above and beyond the number of COVID deaths. And this is a common tool that's used more after the fact to really look at what was the total impact of COVID on the population. I think that's really what we need to be concerned about, and not so much on those individual numbers.
Our final question. Today, the Circuit Court for St. Louis City discussed opening up for trials on June 22nd. As you have explained, African Americans are disproportionately impacted by the virus. When selecting a jury, it's important to have a jury that reflects the city's African American population, which is almost 50%. What are some of the health risks of holding jury trials in general, but also specifically for the Black community?
Well, the challenges of holding the jury trial, I think, are just what everybody would expect. So in the courts and as well as other organizations have to take all of those precautions that would increase the spread of the virus seriously and build that into their plans. And so if that means you have to space the jury out farther or require the jury as well as the people within the courtroom to wear masks and screening people before they can come into the courthouse for illness and for temperature checks and things like that. You know, it's not a whole lot different than running another business where you're allowing people to come in. So as long as we're taking those protective measures, we should be okay. Now, understand that the virus does impact the African American population much more so than the other populations within the city, and so we certainly have to be cognizant of that. But given all the proper precautions that we would take with any other organization, we should be limiting the possibility of spread.
All right, thank you, Dr. Garza, and thank you for watching. That concludes the list of questions we've received from members of the media prior to today's briefing.